while this isn't one of those teaching classes where I have to convey a ton of information that you are going to get tested on. So I'm going to let it focus more on some of the things that I've done, some of my personal journey, and the kinds of things that you could do in your future career. So I invite you to come with me. And as you notice, my Swahili is better than my Spanish. And I have Eric timing me. We're going to go pretty quickly. Today, I'm going to talk a little bit about global humanitarian crisis and global health policy. I can tell you that any one of these slides I could spend an entire lecture on. I've taught whole courses on this. But what you really want to know is, what does it mean to you? What could you be doing? And once upon a time, this is not me, I sat on a roof in Seattle and thought, what could I do with my life? What kind of difference can I make? And I began a journey. Oops, I worked a little bit as a chimney sweep and all kinds of other things. And then I went to medical school. And from medical school, as a fourth-year rotation, I went to Africa. In Africa, my life has really changed. Many of my students have already heard this. I went from practicing medicine in a clinic, in a hospital, until I saw this child. He's a whole story in himself. And it led me to the place where I really wanted to get on the front end of disease and death in community kinds of settings. And I wondered where to go, where in the whole world. So I spent a lot of years living in Africa, raising my children in Africa, doing community health development, training barefoot doctors, doing a lot of AIDS prevention and then elephantiasis. Right now, I've been to 65 countries, and my students know that I have one thing on my bucket list. What is it? Hold babies in 100 countries, and I got 35 to go, all right? And for me, that's a proxy for, am I going to the places in the world that need health care, who need their children to stay healthy, and so I track it by the number of countries I've held babies in. But I started with the same kind of question, what should I be working on? Most of the places, when I first went to Africa, began my career, it was infectious disease, and it was the beginning of the HIV/AIDS epidemic. I saw my first AIDS patient in 1982, before it had a name, in Africa, and then 3 months later in Long Island, New York. So I spent a lot of time at the beginning of the AIDS epidemic where nobody was paying attention to HIV/AIDS. But it's also, oops, there's my AIDS picture, it's women and children dying of infectious disease, dying in childbirth. So that was the bulk of my career. And then, my goodness, we made progress. So I started in the 80s, and more than 12 million children under the age of 5 were dying every year. And we put programs together in immunization and water and sanitation, and look what happened. We're under half of that now. It's just astonishing progress. And my other big issue, HIV/AIDS, well, suddenly the rest of the world was paying attention to HIV/AIDS, so much so that President Bush started the President's Emergency Plan for AIDS Relief. I was a political appointee at USAID at the time, and my AIDS budget actually went from $200 million to $1.2 billion in about 2 years, and then went up again from that. It's now, I don't know, 5, 10, 15 billion, it keeps going up. So, marvelous success. Things are really beginning to change, and other people are owning those issues that had been neglected previously. So what I need to do, where am I going to go next? And I quickly realized that if you look at the world of health globally, what's left are either new things like major increases in chronic disease globally, or it's the bad places in the world. With malnutrition, this is from Katrina, flooding, earthquake in China, with schools that were just pancakes and children, thousands and thousands of children inside of them. Chemical weapons use in Syria, and war. So if you are going to deal with the remainder of the health issues of the world, not the easy stuff, the hard stuff that's left is the disasters and the conflict zones and the combination of the two. So I began focusing more and more of my time and effort in that area. And I discovered as I began this focus, actually I had a little experience already. When we were in Zimbabwe, we had bubonic plague. Young boys were getting bubonic plague and dying of it. We had floods in Virginia when I was state health commissioner. And I was still in Virginia when we had 9/11. Pentagon is in Virginia. We dealt with the anthrax and the response to that. So I realized as I began to look at the global humanitarian world, I've done a lot of policy, I've done a lot of health, I've actually done more emergency and humanitarian operations than I had realized. So the question is, what are the problems that are out there? What kind, how big are they, and I'm sure you're asking, what can we really do about it? Well, this is what's happening as far as disasters go. They are going up very, very significantly, astronomically. This is 1900 to 2008. So the number of cataloged disasters using the same criteria for the number of people who are harmed by it has increased really significantly. We can map by the number of events in various countries. So we actually know where they are, and the US rate's pretty high. Why is that?
Size.
Partly the size, though there are other places as big as the US that doesn't have as many events. I don't actually know, but there could be a lot of reasons. We have a variety of climates and topography. So we've got earth, let's go to the next slide. We have earthquakes and tornadoes and hurricanes, and we have a mix in all of the different places. So you can actually also map out all the natural disasters by what happens in what kind of place. Okay? So I went to Banda Aceh, Indonesia, as part of the tsunami response. This is the waters as they began to come in. I came about 5 weeks after the actual event. Children who survived the tsunami drew these pictures. They called it the black wave of death. And you can see the huge rolling water coming inland, and the little stick figures are the dead people that they saw coming in. And this was left. We actually saw a barge, electricity-producing barge that was as big as an aircraft carrier, had been picked up from the coast and moved 5 miles inland and dropped on the ground. And as we came by, there was a man walking along the side of it, and we asked him about it. He says, "That's my house underneath there. My wife and my children were in that house." So there are really spectacular disasters, like the tsunami, like the Philippines, like Katrina that have happened. There are a lot of natural disasters, but there are also man-made disasters. And you also have ones that are a mix of both. And then there are things like floods in Bangladesh. Is that man-made or is that natural? The monsoons happen every year, but the number of people who are harmed by the monsoons and the flooding has changed enormously because as the population grew, the poorest people moved to the worst lands, the floodplains, and so you now have a poverty-induced increase in the number of people who are affected by unnatural disasters. The China earthquake, how many people died when San Francisco had an earthquake? Approximately. Orders of magnitude.
1,000?
Hmm?
1,000?
Hundreds.
Other guesses? Is he too high or too low?
San Francisco.
San Francisco. He's too high. Last time I think it was 6 or 10 or something like that. How many people died in the China earthquake? I don't remember either. 8,000 in one fell swoop. 5,000 children in schools completely died. Is that because the earthquake was worse in China than San Francisco? No, they were exactly the same on the Richter scale. It had everything to do with how prepared they were and the construction of the buildings and whether they were quality construction that knew up to code or not. And for the buildings in China crushed, and the ones in San Francisco didn't. So is the 80,000 people who died, is that a man-made disaster or a natural disaster? It becomes much more complex. And it also allows us to realize there are things we can do. Same thing with New Orleans and Katrina. There was a hurricane, there was flooding, but why did Katrina really decimate New Orleans? Because the levees broke. So again, are these man-made or are these natural? So what kind of natural disasters are there? You have hints, you all know them. Earthquakes, tornadoes, tsunamis, hurricanes, what else?
Wildfires.
Wildfires, very good. Okay. Others?
Landslides.
Landslides. I have to admit, the first time I did this slide, I put about 8 or 10 things on there. And then I started thinking about it, then I gave the talk, and then I went, oops, I forgot this, oops, I forgot this. People remembered. So I started categorizing them. There are disasters that happen because you have too much water, floods, right? Tsunamis, hurricanes. Why are hurricanes too much water? Because most of the damage and the deaths are not due to the winds. They are due to the flooding that happens afterwards, or the mudslides that happen after the hurricanes. Too little water, I don't think any of you remember that one, right? So if you have too little water, you have drought, famine, wind. These ones are easy. What are they? You said hurricane, tornado, typhoon, that's wind and water. Don't forget the cold ones, blizzards, dust storms. Middle East, my goodness, you can die by being buried in a dust storm. Wildfires, on that one. You can also have land movements. So it goes along with water. In fact, the tsunami, most of that damage, wasn't just the water, it was the mass of the movement of the water. Earthquakes, volcanoes, avalanches, mudslides, and temperature things, right? Heat, wildfires, volcanoes, cold, ice storms. When I became Commissioner of Health in the state of Virginia, I was not expecting that job. And I was planning to go and visit my family in northern Minnesota for Christmas. And I was commissioner, I was in charge, like your Secretary of Health. And they said, no worries, nothing ever happens over Christmas. I went up to northern Minnesota, I'm really in the middle of nowhere, massive ice storm, tens of thousands of Virginians have no power, and you have elderly people dying of cold. We also had our first few rabies kids during that 1 week. I never believed them any longer. I grew up in Minnesota, believe me, blizzards are bad. And then infectious disease. We actually put these kinds of disasters. Think about the pandemic. Think of the kinds of things that make your movies, that WHO announced, and plagues. All of these can be natural disasters. We can, in fact, predict what kind of health problems you will have for each one of them. What kinds of problems, health problems, would you see in an earthquake? Why do people die? What kind of trauma? Why do they die?
Crushed by buildings.
As an African, I would have to come and take your baby, but I won't do that. Okay. Yeah, crush injuries and compartment syndrome. Why do people die in a flood? Actually, drowning is one of the less common ways. They actually tend to get injured more than anything else. So for each one of these natural disasters, if you go to the CDC website, you will see the spectrum of injuries that you can predict will happen. It may not be absolutely perfect. When do they die? Any of them. Pick a disaster and tell me when you think the most number of deaths will happen. At the moment, which one? Tsunami. By the time the first 8 people got there, within 24 hours, it was the Australians, sent a whole team of people, 200,000 people were dead. You then had hundreds, believe me, literally hundreds of UN agencies, government agencies, militaries, NGOs, all began to show up. UNICEF didn't even get there until week 4. I didn't even get there till week 5. We were saving the bits and pieces. We're doing surgery on children who had cancer because we had a whole lot of medical facilities there, and the people that had been hurt by the tsunami were dead for the most part. Think through how almost all of these things happen, and they are all, basically, the majority of the deaths are going to be within the first 24 hours. What does that mean?
Mobilize faster.
We need to be mobilizing faster. Okay? Definitely. Let's see where we go next. So many of them are actually very distinct. Many of them are very different than others. So one of the key messages I want to give you is, we talk about acute disasters, and I just talked about how quickly people die before aid can get there. But how often do they really happen without us knowing that they're going to happen? Right? Think about hurricanes coming to Puerto Rico. Is anyone surprised anymore? No. You know when it's hurricane season. You know when they are coming. What about the earthquake in China? You actually have a fair amount of notice, and in fact, you could have some pieces in place before. The myth of the quick response. People think that the whole world mobilizes, it gets up onto TV, but if all the deaths are in the first 24 hours, well, we barely even get the word out in the first 24 hours, let alone people getting to the place where they are actually needed. I was just in New Orleans 2-3 weeks ago. How do you think they're doing right now?
I think I hear they're doing better, but they have not really recovered from the disaster yet.
They still have places that are not fixed, not recovered. They still have people who have no homes, that are still refugees elsewhere. And where did Katrina hit? New Orleans, in the U.S. What do you think happens when you have a disaster in another part of the world that doesn't have the U.S. resources? How fast do they actually get over it? How long ago was the Haiti earthquake? They are still just totally decimated. So we forget that it takes a very long time to recover from a, quote, natural disaster or anything else. How long do people who are moved out of their homes, whether it be into a refugee camp for a natural disaster or a war, what's the average amount of time that they are displaced from their homes?
Is that like 10 years?
10 years? Any other guesses?
Most never come back to the same place. Most never come back to the same place.
Some never go back. So you have the exiles. We see that in the U.S. You UK, Australia, a lot of people who are permanently exiled, especially if it's conflict zone kind of things. The average time in a refugee camp is like 18 years. And many of them go as long as 30 years. People leave their homes, whether it's the Pakistan floods and earthquake, they move into a refugee camp, and the refugee camps are set up to be temporary, right? They're just refugees. It's a quick kind of problem. And they raise their families there. They have children. The children grow up. They don't go to school because it's a refugee camp, and you have it going on for years and years. We talk about, especially us public health people, you need to know what's going on. Do you really? Do you need to do a needs assessment? You're in a disaster zone? Yes, you absolutely do. But you can, you do a rapid assessment. Because in fact, you can pretty much predict, depending on the kind of problem, do I need to do a water and sanitation kind of needs assessment? Am I worried about infectious disease in this particular place, in this particular country? So you do need to do it, but you need to not overemphasize it. You don't wait weeks more to do a thorough needs assessment. In fact, you could have done most of the needs assessment in advance, right? You could have had the profile of the basic health needs. You know what kinds of injuries and problems would happen with that particular problem. It's just a matter of what's estimating the size of the impact. So you can actually do it for most disaster zones ahead of time. And then you should do it afterwards as well. There are a ton of totally awesome videos on, pick your disaster, from tornadoes to the tsunamis. I started looking at them, and it was both interesting and devastating. But those are the natural disasters. That's a small part of what's going on. So I showed you that natural disasters are going up. What do you think is happening in armed conflict and its contribution to health problems in the world? Up, down, the same?
Up.
Well, look at many people die now in our country.
It's actually really bad. Both the number of people and the number of wars are going down since 1990. And in fact, there are fewer countries that are experiencing war. You think back, the number of unstable countries in Africa, the number of unstable countries in Asia, Latin America, there are actually fewer of them. One of the, let's see if I've got it on the next one. Nope. One of the most important things is war used to be much more about one country at war with another country. And more, the wars that we are seeing, the conflicts we are seeing, are within a country, like Syria, like Burma, like Congo. What does that mean for us as health people? That sounds like it's a State Department problem.
Probably be more difficult for us to go in and help people because, just same, if you go and help some people, maybe their enemies, which are maybe their brothers, their friends, will.
That's partly, I'll tell you, conflict zones are always dangerous.
Yeah.
But there's also the issue of sovereignty. This is their country. When the U.S. was having civil rights riots, people did that. What if another country had decided that our government wasn't doing it properly, and they decided they would come into our country and intervene? Would we not have all thought that was appalling? Yeah. So when you have a conflict inside one country, when do you intervene? When do you go into when you're in South Sudan or in Sudan and the northern Sudanese are killing the southern Sudanese, and then Darfur, when Syria is using chemical weapons against their own people, when are we or other countries allowed to go in to intervene? I lived in Zimbabwe. It was pretty stable when I was there, And Mugabe, the president, has systematically destroyed the economy of the country. There were 10 million people starving. Save the Children and a whole bunch of other NGOs were going in to try and help those people, and he kicked them out because they were the other tribe that he didn't want to have receive food. So there were old women walking 10 miles to get food for themselves and their grandchildren, and they were turned away with no food, and they went home and died. We did intervene in Zimbabwe. It's still going on. When do we get involved in those kinds of things? Because in fact, people are dying, and they are dying of health-related problems, right? And who gets it? This is a quintile analysis looking at within any one place which people suffer the most. And you could completely expect that the highest death rates are going to be the poor, right? Because the rich, they leave early. Happened in Europe during the Nazi regime. It happened in the Cambodia, the Khmer Rouge. Those who were educated had means to get out of the country and move to other places, part of the exile. So you can also see that the relationship, no surprise, between the number of children who died and conflict is a very, very strong relationship. The more nations and the larger the conflict, the higher the child mortality rate. Okay, so complex humanitarian emergencies. I went from natural disasters to conflict. Complex humanitarian events are that mix between the two. So you usually have an inciting event. It could be a natural disaster, or it could be a man-made thing. It could be Bhopal, the factory that exploded, or it could be a Syrian crisis. People move away from bad places, right? They go to someplace else. You lose the societal infrastructure, and of course people are concerned for their own safety. One of the things that most people don't realize, and a really good friend of mine is one of the premier disaster epidemiologists, Les Roberts, who's at Columbia now, that most of the people who die in a conflict or in a complex kind of situation don't die of war-related injuries. They don't die because they step on a landmine or somebody shoots them. They die because the system is broken and they can't get to care. So what you see, I'll do this one. You'll see it in a moment. Not every place gets attention when things are going badly. So are we intervening in complex situations because there are great needs or because of politics? How many of you have ever heard of CAR? You can guess what it is. How about if I tell you it's a country? Not going to guess what it is. Not high on your radar screen, is it? So it's Central African Republic, probably has the highest ever recorded rate of child mortality, human rights abuses that are unbelievable. And it's a small little French-speaking country with no diamonds, no oil, and no attention. Is it because they have no need? That's not so. Is it just they're not high enough profile for anyone to care about? So as we're looking at the whole disaster scenario, who gets the limited amount of political attention, money, resources, and who will intervene? In the Rwandan genocide, there were people who predicted it in advance, said it is going to happen within the next days, weeks, or months. And everyone said, no, it won't really happen. Congo, Darfur, Afghanistan, a lot of difference. People pay a little bit of attention to Congo. They hear about it occasionally, but not very many people go there. Darfur got more attention, partly, I think, because I had a boss who was the head of USAID who made it his crusade to get attention to Darfur. And how much attention does Afghanistan get? Lots and lots and lots. and opportunities to go and work there. I'll show you some of the stuff I've done in Afghanistan. Zimbabwe, you guys didn't even know they had a problem, did you? No. Syria, we're hearing about it. Who's doing anything? We don't really know. So the question is, what was going on in these countries before? How bad is it really? Even Iraq, when we were trying to figure out how to rebuild Iraq, what were their health indicators previously? Ooh, we thought we knew, but maybe not. And then how much problems did the conflict and the war itself cause? So it's really complex. What if you're in a refugee camp and you can see, well, pretty obvious, a rifle with an X through it. So if you're in the refugee camp, you are not supposed to bring your rifle into it, right? What does that mean?
You can't defend yourself.
It means you can't defend yourself. So if you are in Darfur and they take your weapons away as you come in, that means when the other group, often a government military, comes in, you are totally defenseless. So in the area I lived in Kenya, at a much lesser scale, the Kenyans had disarmed all of their tribes, but the neighboring country, Uganda, had Idi Amin, and US and others armed the people fighting Idi Amin, and then it all finished, except on one side of the border you had armed tribal groups, on the other side of the border you had unarmed tribal groups, and they all thought they should have all the cattle in the world. What does that mean? That the ones who had arms would cross the border at night and take away all the cattle, and the people in my part of the world, part of Kenya, lost their income, lost their food, and had starvation and other problems. What do you do? We've talked a little bit about this, things like Syria with chemical weapons. This is probably, for me, the scariest. I'll go a lot of really scary places, but the idea of facing a place where there's no inhibition to dealing with chemical warfare is really scary. Okay, so who does respond to global health kinds of problems?
Some of the international health associations like the WHO.
Okay, WHO. But,
ADRA, they also help.
ADRA does a lot. So what is ADRA?
I know it's from a religious affiliation, Adventist, and they actually go and help with different.
So we would talk about them as a non-governmental organization. They're definitely non-governmental, or a faith-based organization. Lots of both of those in regular global health things. So I'm going to try and keep to time, but WHO, UNICEF, UNAIDS, there are a whole bunch of UN agencies. UNHCR, this is the Refugee Agency. UNFPA, that's family planning. Oh, so a whole constellation of UN agencies. And then actually a whole constellation of governments that are donors. US is still the largest donor, both in regular development aid and in humanitarian aid. The World Food Program, which I forgot to put on there, is funded almost 50% by the US government alone. All the rest of the countries give to it. So we're a major player. Then there are the recipient countries. They actually help too, both in money and in tasks. So the first, this one, that should be Afghanistan, Zimbabwe, that's Ukraine, and then there are the NGOs. And when I was at AID, we probably had 4,000 health NGOs that we worked with. Some really big ones like CARE, some really small ones, and local ones, Save the Children, World Vision, and now the new players on the block, things like the Gates Foundation and others, the Global Fund, the Multi-Sectoral Partnership, and Gavi Alliance. And don't forget, we actually get some really awesome work done by private sector. Shell Oil did scenario planning for disasters, for AIDS scenario planning. When we're talking just the disaster scenario, we have a smaller group of players, and in fact, You're usually a very different group of players. Both the UN agencies, the parts of the US government, or the donor governments, and the NGOs are a little different from regular health work to disaster health work. So you'll see UNICEF and WHO are the main players at the global level. WHO has what's called cluster arrangement. This was like the new thing post-tsunami 2005. We're going to get ready. We're going to have a health cluster. We're going to have a water sanitation cluster. We're going to have an economic development cluster. We're going to have a safety cluster. So one of the worst things that happened in Indonesia, UNICEF's #1 task when they got to Banda Aceh, Indonesia, wasn't to do a health intervention, wasn't to bring safe drinking water. It was to find the children and protect them and reunite them with their families, because within 24 hours of the tsunami hitting, the child sex traffickers had already arrived in Banda Aceh and were finding the children who had been separated from their parents. And if you want to find vulnerable people, where do you go? They're all grouped together in the refugee centers, right? And they don't have any protection. So sometimes being in a refugee center is more dangerous than any place else. So UNICEF has had a very interesting role in some of these things. Lots of funders, implementers. How many of you have heard of MSF? Médecins Sans Frontières, Doctors Without Borders, right? They are probably the best known medical care group. They do clinical care. They're probably best known not because they're necessarily the biggest, but because they go to really hard places and they're very activist oriented. They try and tell the story that's out there. Role of national governments. You have to work with them. We'll talk a little bit more about that. But it can be really difficult. Sometimes you're trying to work with them because they are the government in that country and they are also the perpetrators. Think Libya. Think West Bank, Gaza. I mean, place after place. And other times, it's their countries, but in Indonesia, the whole medical community basically said, you know, I just lost my whole family. I can't deal with taking care of other people right now. And they may just be too traumatized to contribute to the care and the rebuilding of their own country for some period of time. So who gets hurt when you have a conflict combined with a natural disaster? The most vulnerable. This is pretty obvious, except we often forget when you, this is one of my favorite ones, you're in a refugee camp or Haiti, food and water distribution center, right? Immediately after the earthquake, there were people who had no food, who had no water, and you set up a distribution center. Who's going to get it?
People that can mobilize.
Hmm?
People that can mobilize.
People that can get there. The first people that will be there are unlikely to be your small children, unless they have an adult with them. They are unlikely to be your pregnant women, right? They are unlikely to be those people who are hurt or disabled, because they're hurt or disabled and getting someplace is very difficult. They are unlikely to be the elderly, because they're walking slow. So if you only have a limited amount of stuff, those people who are most at risk are least likely to get it. You have a refugee camp in the middle of a mud field. I hate to tell you, that's really common. You put together a place where the latrines will be. Do you know who can't get there? The people who can't walk through the mud to climb the steps to get into the latrines. So even our responses, we need to think about who is the most vulnerable. And I mentioned the protection issue, which wouldn't seem like it is necessary, but there are people just waiting for these opportunities. Sorry, I did something. So what's the difference between refugees and IDPs? What's an IDP?
Displaced person.
Internally displaced person. Okay? We talked a little bit about that, and I'm going to give you the answer because it's time. So, refugees have crossed borders. They've lost the protection of their own country. They're moved into another country. Sometimes the recipient country is not so thrilled, but international law now covers these people. Our international aid agencies specifically have money for refugees and not necessarily for internally displaced people. Okay? Their own country is supposed to be responsible for them, and they have no special status. So within our U.S. government, USAID, our foreign aid arm, takes care of USAID takes care of refugees, and the State Department deals with IDPs, and they don't interact between the two of them. And as I showed you how conflict is changing, the number of people total is changing, well, the other change is more and more of those who are being affected are internally displaced because the wars are not crossing borders anymore. So our most vulnerable population are populations we may not be able to get to very easily. And it's growing significantly. And the whole thing's really complicated. So this guy looks like a perpetrator, doesn't he? Right? You see him and I'm scared. What about this one? There are a lot of child soldiers out there, many of them unwilling, but also still very involved. What do you do? How do you respond? This is the how long do people live in these kind of circumstances. I actually have the equivalent picture from New Orleans, where all those people lived in the dome without much food and water and no trash collection for weeks. A lot like that as well. So this is probably one of the most important things. So what kind of problems do they have? You have the specific kinds of problems that are from the crisis. You have the violence, you have the wounds, you have the landmines, you have the crush injuries from earthquakes, but you have mental health consequences. We'll talk about that in a little bit. But we have a lot that are due just to the fact that people can't get their regular health care. They're not there to do their immunizations. You're pregnant and you don't have any place to go to deliver. You have ongoing health needs that aren't being met. So Lebanon is a second, almost first world country in good shape, and then suddenly it had a war, and the South was cut off. And the two groups that had the hardest time were the middle-aged and elderly diabetics and people with heart disease who couldn't get their meds. There was no supply. And the young babies who had already been weaned, because only 5% of the women breastfeed there, and suddenly there was no formula. What do you do when you have a whole population of babies and food for them, and they can't drink milk? And the world has a global policy against delivering formula because we don't want to foster dependence on formula. Huge policy crisis that had to do with supplies. We usually think of really horrific malnutrition and disaster kinds of things, but the truth is most of it is the same stuff they have every day, all the time, but the rates are much, much higher. And we measure it not in how many people die per year, but how many people die per day. And some places easily get up to more than 5 people a day. So this is the Rwandan Exodus, 1994. 800,000 people were killed outright, were murdered in the genocide in Rwanda in 100 days during that period of time. I went to see the site 10 years later, and they had gathered everybody together. But the ones who weren't killed did a massive exodus to the neighboring countries, to Congo. And over 1 million people, within a few days, went to exactly where I had done my very first time in Africa, in Zaire, which had now had a volcanic eruption. It was essentially a great big mound of volcanic rock with a million people on it. There was no water. You couldn't dig through the volcanic rock to make latrines. And this is actually a slide from Liberia, but this is exactly what happened, and you could have predicted what happened in Congo with the Rwandan refugees. Sudden, massive increase in cholera, diarrheal deaths. And do you know how they count this? By the body bags lined up on the road every morning. That's your epidemic. You count the body bags, and it's accurate enough to tell you, oh, a really big problem here. It has to do with water and sanitation, right? So again, the key thing is excess deaths. And the excess deaths are above what they would normally have, and most of them are not conflict-oriented themselves. My worst case scenario is, what if you were pregnant with small children and you were on the run in a conflict zone? Can you imagine anything worse? You can't move very fast yourself. You can't move very fast because you've got a child and you've got really awful people after you. And this is what a lot of Congo is about. Some of the worst rape atrocities I've ever heard of happen in Congo, which leads straight to our mental health consequences. So you all hear about PTSD, right? We hear about it in our returning soldiers. And you can see how it's growing internationally, right? Really big deal. Oops, wrong way. But in the rest of the world, not just our own soldiers, what is happening to them? So PTSD, oops, there we go, is something that people who have a significant event experience. They get traumatic symptoms, right? Re-experiencing and other things. It isn't just those who are directly hurt. It's also all of those who experience it, see it, lose family members because of it. And I had the Minister of Health of Afghanistan say to me, every single person in Afghanistan has PTSD. I think he's maybe exaggerating a little bit, but every single person in Afghanistan has experienced trauma, war, and loss, and they're not safe yet. So how long does it last? Rwanda post the genocide, 15% had symptoms a decade later. Bosnia at last. Afghanistan, 84% of people had a family member killed. 43% were clinically having PTSD, and many with suicidal ideation. Post-Iraq, 2 years later, 80% still have PTSD symptoms. Khmer, remember the Khmer Rouge atrocities? 8 to 12 years later. Some people get better quickly. It has to do with how bad it was, how long it was, and frankly, or not, right? And then individual things. Social support, faith support all make a difference. So here's what you really want to know, right? What can we do? Are you ready to go, right? First is, you have to be prepared. There are things we can do in advance. We need to be there in the first 24 hours. How do we get there in the first 24 hours? Well, put in early warning systems, put together things that are staged, ready to go. You have the right things ready to go. And the most important is get people back to normal lives as much and as fast as possible. Get the kids back in school. Get people back to work so they can have some semblance of regular life. We do that same thing for people grieving here. So, should you go or should you not go? I had the opportunity to live on the Mercy ship. I was on an aircraft carrier. I did catapult launches off of the aircraft carrier and craft landings in a little jet. see on the J things, I have to do those. I had Marine guards and convoys in armored vehicles go to clinics. But it's a little dicey because you can, in fact, just be in the way. When I went and visited one of those clinics in Afghanistan, I had 35 young Marine guards and 7 vehicles, who knows how much it all costs, all bringing me so I could go and talk with a community health worker in the district. Did I change anything? Did I answer, fix any problems? Who knows? So if you're going to do it, you have to think about where am I actually contributing? What's going to be different? Don't presume you know. I can't tell you how many times I've seen not good things done. And that includes going for a couple weeks, right? Many of these problems, as you've seen, are complicated, they're long, they're hard. If the solutions were easy, we would have done it. We've done great work in all kinds of other areas. So if it were easy, we'd be doing it here. So most of the best work happens when you realize that the others have something to contribute to it as well. I know I have so much trouble. The first time I went to Africa, I brought all my clothes for 3 months in a little tiny carry-on, and I brought 2 suitcases full of medical equipment for the hospital we were going to. We had urethral catheters and all kinds of things. Never should have brought them. All it did was fill up their storeroom with things that they were never going to use again. But you can give money to the people that you know and trust, preferably those who have done it before, those who measure whether they're making a difference or not, and those who are in it for the long haul. The NGOs get a ton of money in the first days, weeks, and 2 or 3 months. But Indonesia's not rebuilt, Haiti's not rebuilt, Katrina's not rebuilt, and nobody's sending money anymore. All right? You need to ask what people need. There are standards, and if you can, give some international experience before you go to a disaster. Listen to the people. So I was in a shura with a whole bunch of Muslim men, and they said, because of the health program that the U.S. government brought to Afghanistan, our women no longer die in childbirth, our children are healthy. That is a peace dividend. We're going to make sure the Taliban don't take over again because we want this peace dividend. We want our children to grow up healthy and safe. The women told us, in the next generation, women will choose their own husbands and not get beaten up, and women's suicides will go down. Work with the local leadership. The Minister of Health in Afghanistan, right after Taliban, was a woman, an OB-GYN surgeon, and a general in the army. And she had the whole world saying, here, we'll give you money to rebuild Kabul and hospitals. And she said, no, we're going to train midwives, we're going to do rural community health work, and she refused to be swayed by the wrong emphasis. And Afghanistan is a fabulous example of how a country still in conflict can make incredible progress. Their maternal mortality rate was 1,600 per 100,000 in 2001, 2002. It's now about 300. Absolutely enormous progress. The local leaders may not look like you think they should. This is in South Sudan. Our leadership interactions were with the Sudanese Liberation Army. They had not yet signed the peace accord, and they were the rebel army. And the general that we talked to laid out how he was going to rebuild his health system from the center to the district to the local clinics, and it was utterly astonishing, his understanding of his country and the health system. And he said, and what we want you to do, U.S. government, send us back all of our Sudanese doctors who are exiled in your country and pay them so that they can come and rebuild our health system. Brilliant idea. I don't think it happened, but brilliant idea. Prioritize the most important things. Don't do things that don't last, that aren't appropriate technology. This is a very simple well that was put in And then the people didn't know how to fix it when a linchpin broke, so they pulled the top off, put buckets down on a rope, and the rope had poison in it and totally contaminated the well. Equivalently, our DoD does lovely work in places like Afghanistan, but the wells that they did were diesel power generated, and they were huge. Lots of water was going to be made available in a very dry country, only after they left, no one could afford the diesel to keep it running. And so they had no water again. This one's probably too complicated for now, but the most important thing is unrealized expectations. Promising more than you can deliver, or more than can be delivered after you leave, can cause more harm than good. We go in with our American medicine for 2 weeks and do wonderful things. We've got good antibiotics, we have a good clinical diagnosis, and then we leave. How are the communities going to feel about their own physicians and healthcare providers once we're gone? You can, in fact, undermine what's already there and make it worse by good intentions. There were ways we dealt with hunger and famine in the past. Therapeutic feeding centers, putting kids in hospitals, school feeding, and what we found was it didn't make much difference in nutritional status. The mortality rate was really high, it was really expensive, and we can do it differently. We in fact know now that you should go into a place, and Haiti was our example. Do you know a community is at risk of malnutrition? You feed all the kids that are underage too. It costs less, they never become fully malnourished, and you can prevent a famine from happening. Plumpy nut, I forgot to bring my plumpy nut. Sorry guys, I actually have it, and some of them have had it, but there are new ways to treat severe acute malnutrition. I mean, really just short of kwashiorkor, and you can do it at home without people putting children in a hospital setting. There's a lot of talk about peace building and resilience. Kids are really resilient, aren't they? These are children from South Sudan in the middle of a war zone, and yet friendly, joyful, fun. How do you build that? If you know you're going into a place where the population is not unified, and you go to the village leader and say, where should I put the well that you need? He'll say, where will he say? Can you guess where he will suggest that he needs to go? His front yard, right? He's the village leader, he's the power person, and almost always you'll get that kind of response. But in fact, if there are factions within it and you put the well in one place, you may, by helping one part of the community, incite new or larger divides and increased war within it. So in fact, part of peace building is knowing the social and cultural interaction. And you know who usually knows and doesn't ever get asked? Are the women and children. The ones who have no power, the ones who don't usually have any say, but they know everything that's going on. And if you go and ask them, they will say, well, if you put it here, this guy's going to get mad. If you put it here, this guy's going to get mad. Here's the place that's in between. And so sometimes peace building is all about going to those least powerful and finding out what's really going on. All right, there is a disaster management cycle. We used to spend all of our time in humanitarian operations right there on that big bomb when the thing goes off. And there is lots more emphasis on faster response, rehabilitation, rebuilding, but all of this work now on prevention and mitigation in advance. So basically we can predict the disasters, we can predict the harm from disasters, we know the hard places. I will tell you, having spent a lot of time in Afghanistan, you can go and work in the middle of conflict zones and make a difference. Now, I hate to tell you, in some places, the women have an advantage, because when I put my scarf on, and I keep my eyes down and I walk slowly, can walk the streets of villages in Afghanistan, and American men might not be able to. In other places, sorry girls, it'll be really dangerous to be a woman in some of these places. So we can prevent some disasters, we can prevent the harm from some disasters, and we can mitigate the health problems that come from them. Okay. Questions? I took you all across the world. Thoughts and questions? Who wants to go?
Yeah, no, I don't know later.
I have a question.
Yes.
This was a while ago that I read this, and I haven't kept up to date on it. But I had read that Haiti was